Good morning. This is Dr. Bill White again with the American Orthodontic Society, and I want to talk to you a little bit this morning about tongue thrust and just kind of give you some idea of what the tongue can do and the pressure that the tongue can have. And this case is just a good example. This little girl would put her tongue where she pushes it, and I got several pictures. That's kind of hard to do on there. And I was thumbing through some stuff today, and I came up with a picture of myself. I thought I would just show you that it was taken back in it was either 49 or 50, and so now it's 2021, and this it won't be too long here. We're going to be 22, and I was just going to show you what about 72 years will actually do to you. And this is a picture of myself when I first went into Baylor University down here in Waco, and then later I went on to Baylor Dental School. And so that'll give you some idea about what it'd be close to 72 years. All right. We had a lot of bands left over when we went from bands to the brackets and everything. And we kept these. In fact, another orthodontist there in the area I was practicing in there in Hurst, Texas, gave me his bands just to use. So these are the lower anterior teeth. This is an upside down or mirror shot, and this is just the band with the bracket on it. And we would fit these bands to the teeth, and then we would spot weld an 030 wire onto this tooth right here, like that, coming up. And we'd spot weld it where it was really stuck on good, and we'd have one stuck over here, and they come way on up, you know. And we did that to every lower anterior tooth. And then we're going to come back in and we flow solder over this whole thing. And we solder this, and it's spot welded and soldered to these bands. Now, we didn't use it there. If we did in this particular case, I don't see where I put this in. But we'll take these and then bend them back up to where the teeth met underneath there. These little bars that we'd have would come off the tooth and kind of come up and point back at the tongue. And that tells the tongue immediately. And your tongue will go up there and touch these things about a couple of times, and it kind of pokes it, and then it just stops going up there. And I had an MD, a medical doctor, that was a bad tongue thruster, and we put these on him, and I said, I want you to tell me exactly what reaction you have to them. And he told me the same thing. He said, I went up there and stuck my tongue once, and then I was cautious. I did kind of stick it in there one more time, but after that, the tongue just wouldn't go there. It just, your tongue seems to have a brain of its own. You bite it, you know, somewhere, and you may bite it the next day where you bit it the day before, but I guarantee you won't bite it again because it's sore and it hurts. And that's the way we train the tongue. But you need to get somebody breathing through their nasal capacity up here, and that helps you keep your mouth closed and not pushes the tongue out that way. But anyway, that's what we normally would use here, and I've got that on several videos. You can go and look and see. I'm going to go straight now to the little girl, and she was very cooperative, and you can see that she pushed her cheek out like that, and the way the mouth is kind of at an angle in here, and this fullness of the cheek where the tongue actually, where she was missing this molar tooth hadn't come in. Anyway, she pushes the tongue through that gap. Another view of it from several different angles. Sorry, I've got back over here. Now, here are the teeth, and this is, I got her to, when we had it, to swallow while she had that in her mouth. And look, the tongue is actually protruding out through a gap there. The bite is open, and the tongue comes through this whole side of the mouth. It's pushing these teeth forward, and let me show you those in a few minutes. So the tongue has a tremendous force and aids in bringing the teeth in. Now, if you don't have this habit or this problem, tongue thrusting, the tongue actually pushes these teeth out, and your lip catches them here, and it pushes these out forward, and the lip on the bottom catches too, and that's why anybody's teeth come in correctly if they can do that. But if they're breathing through the mouth all the time, they will not come in that way. The tongue has to be down in the bottom arch down here if you're breathing through your mouth. So these teeth spread out more down on the bottom, and these spread less, and that reduces the airway, which was up in here, and the thing gets even worse later on. So when you see somebody that is a tongue thruster, go in and do something and see if you can break this habit, regardless whether you want to call it a two-phase case or not. All right, I'm going to try to get on here a little bit. This is another view. You see the tongue coming through back at the back where it looks like a second deciduous molar must have come out from some reason or another there. And on the other side, a similar opening, and you can see where the tongue filled out. Now, here's what I want you to remember. The shape of this arch is kind of like that. And when we finish this case, I'm going to see if I can drag some of the later pictures of it and put them beside this and let you see the difference. Now, this part of this is just pushed out there and caused by the tongue, and the pressure of the tongue is going this way, not filling out and pressing out the sides. If you swallow properly when you're got your mouth together and everything, when you swallow, you're going to bite down anyway, and the shape of this will come out big, similar to the shape of the tongue. All right, let's go down on the bottom. That tooth is missing or just hasn't come in. That's the second bicuspid that will be trying to come up through that. Now, here we used this little step down arch. Now this gets the arch wire down out of the plane of occlusion, where if you just ran it across here, but you don't have anything to attach it to, since these teeth are trying to come in that way. So we drop the arch wire down in here. Now you can put a bend in this wire right around here, and you can have it come out like this. If you had a closed bite, then you would raise it up and hook it in these teeth, and it would make them all go down as they erupt into the mouth. That's one use we have it. And you can expand them or you can contract them. By how you do that, we'll try to show that later. Well, let me just kind of draw a picture of that. Like if we have a molar tooth here and we have a bracket, something like that, and you've got a tooth bicuspid trying to come in here, and you've got another one that's up a little bit further here, and then you got your cuspid in this area, and you've got this, and you say you've got a bracket on the cuspid, something like that. You can come out of here with this, drop it down, and come up this side of the cuspid, like that, and then go around. So you can put a bend in this arch right here and have it angle off here. You can, and it would come up, and then you go around the arch, come up again and go back, and you got another molar over on this side, and it will attach there. And you can raise this up and hook it to these teeth and intrude the teeth with this wire like that. And it's a most useful thing to do that. Now, let me go back and show you, like if you've got a molar tooth coming here and you've got a bicuspid in this area, we can draw a few roots on there, make it look a little more natural. And we want to pull this tooth and these two teeth together. We can come in and come across this, drop this down, come over here like this, drop it up right behind this bracket where it's holding on there. But where you come out and you go down here, you come up and you make a little deal like that. And now you can tie this back, and when you do, if you pull on this to tie, the top of this will go up like that, and the legs will go down this way. I'll try to illustrate that on some wires that I've got here that I just bent to try to illustrate that. Let me get that off the... This is one of the most useful wires that you'll learn to bend. Now, if you're... I'm going to hold it up here. I think you can see it with that. I'll get it up here or get it back. But we come up and you make this loop, and you can tie this to your molar tube back here in the back. Now when you pull on this, the center of it will rise up there. Just see as I pull on this, that kind of rises, and the two legs of it will go down like this. And that's in the bracket. And that's pulling back. So the tooth has a pull on it, and it pulls the root ahead of the crown actually. But you pull on it, and the crown and the root will go back together, and this will come forward, and the teeth will end up parallel without tipping the crown. And now if you just pull straight with a wire across here, if you just run a wire across here and put an elastic or something up here, and you pull on it, then this tooth will be lean like that, and this one will be lean like this, like that. The roots, actually the root rotates somewhere down to a point like that, and when you pull on this crown, this will change, and the tip of the root will actually move in this direction opposite from where the crown moves. And then sometime in there you've got to straighten the thing up or it just doesn't work right to do that. Now, if I'm pushing the teeth apart, let's erase that, and I'm going to make another clear deal. Like we're going to have a molar in here, like that, and then we've got a bicuspid or something. Maybe we want to make room for something else to come into this spot right here. Then we can put the brackets on this and a tube back here. And you take this wire that runs through here and go down with it, go down right behind it, come back up over here and hit that one too. Now you make this wire come out something like that, so you gotta push it together to get it between the two brackets. So when you push it together, if you push this together, the bottom of this goes down this way and the legs go up this way, like that. And so as you're expanding the gap right here, this wire will tend to move the root of the tooth something like this. But the pressure, if you don't have that, just pushing straight, if you just push on it with a spring or something like that, then this tooth is going to lean in this direction and the root will go back here, but the crown will come on out here. That way, that's not what you want. You want to pull the two teeth together and have them come in and be parallel when they get there. So that's the beauty of this little step-down arch that we've got here. Let's erase that and let's get back on our case now. And we're gonna go through this, and we've worked up into a rectangular arch. It's 1975, and so we can intrude, we can torque these teeth to come, the roots to come out or in, however you want to do it. Line them up and pull them back and have them, the teeth sitting in there just like you want. Now the problem with bands, you got 2 layers of steel between every tooth and 2 layers of cement, and when you get through you got to close all that space, and that was a real problem when we had to have bands and didn't have the brackets. All right, we go to the next. There it shows that step down arch. Now this gets this arch wire out of way. Otherwise, if you were running along up here, of course the teeth aren't in, you couldn't put it in there. If the wire goes up there, sometimes you bite down with food and you bend this wire and that screws up the whole mess. So you drop this down, this is a protection from that, and with that drop down you can push this one that way or you can pull it this way. You can go either way you want. You can go up with them or you can go down with them, and you can push them out and up at the same time. It's just got a lot of useful things about this step down arch that we've got here, trying to show you how to use that. And you can be torquing the anterior teeth at the same time. All right, now we've got a couple of baby teeth here which will go. Well, that's a permanent tooth, I'm sorry, and that is a baby tooth there. And then we're getting in the mixed dentition. Now in the mixed dentition you can just run a wire straight, but on the bottom you need to do the drop down to keep from chewing against that arch wire. Let me see what we've got here. Now there's the bottom. You see we run this down, come over across to the molar, come up, and now we're waiting on these teeth to come in. And when they get in all the way, we can stick brackets on this, maybe this, and then you still have to wait for that one to come in. But that's the primary use of this step down is in mixed dentition, but there's those other uses of expansion, intraction, or depress the tooth or exfoliate the tooth. Either way you want to go, you can move it with that step down arch. All right, that's another view of it. And while we're doing all this moving up and down and stepping down, we're changing the shape of the arch. Now we needed to bring the upper back some, so we're putting this occipital headgear that comes off of here, and we've got it, we cut this off, and this is sticking on the molar. And at this point, you'll be tilting the molar up. You can cut this bar short, say you have your hook back here, and if you go through it and do it over on the other side, your weight will be right here on the front teeth. And if you just come out right from here and put your lock deal, it'll be all the front teeth. So it picks the teeth up like that. I didn't draw it properly. So there's all sorts of ways of using this occipital type headgear, or you can do a lot of things with the cervical headgear also. Now that's going in, the upper bicuspids drop down on that. Now we go ahead, here is 1976, and we've got the teeth in, but looks like they're not sitting in there properly. Now just remember this, if you remember, this came back like that when we started the case. That's the bottom. Okay, I think that's, no, that's not the end of it. Now there's the bottom arch as full as it can be. And if you went back through the case, you'll see that the arches were way off from this. Now we've moved back. We have to get back into the PowerPoint to get this. Now this arch formed, if we went way back to the first of this case, which I hate to do, but you could see a drastic difference in the width of this arch, where the first arch was more like that and protruding out like this. So you can go back and run that on your own. So this is the all we're going to show in this particular case. I appreciate your watching, and I hope you join our group and subscribe to our website and all these things. This is a fabulous thing that I'm sitting here talking to you and showing you these things, and there are people, and they write back to me, and a guy from Bangladesh here, the other guy wrote back, or some countries you never hardly ever heard of them, and they will write in to thank you for showing you how we might do that, and if they don't want to do it, they go to your orthodontist that you have, and if he doesn't want to, show him the video of it, and maybe he learn something too on this. So we're trying desperately not to teach you anything that is not absolutely correct, and that I think will last through the time, and I hope that they do. And so I'm going to hang up here today, and thanks again for dropping by and seeing us, and we'll probably continue with this thing for another, as long as I can do it. So thank you very much, and I'm going to close out here.